Monica, do I send host back to you?
Hello? We're ready to go.
Good afternoon.
On UGTV as well.
Thank you. Good afternoon. Before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely as well as on site. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and his current guidance from the Kansas Attorney General. I'd ask the clerk to announce the meeting and call the roll, please.
Good evening. You are hereby notified that I have called a special session of the Unified Government of Wyandotte County, Kansas City, Kansas, to be held Thursday, July 29th, 2021 at 6 p.m. in the fifth floor conference room, 701 North 7th Street, Kansas City, Kansas, for an update from the Health Department regarding COVID. Roll call. Townsend.
Here.
McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Payne. Commissioner Markley has sent a letter of absence. Walters.
Here.
Philbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Alvey.
Here. Thank you. Tonight we have an update from our health department regarding the progress of the COVID. I'll turn it over to Mr. Bach.
Thank you, Mayor.
Getting a lot of feedback.
Yeah, I think we have multiple mics on here. They're trying to get them shut off in the conference room. This thing has have changed in the world of COVID for the past couple of weeks, and leading up to this, we're planning an update. As we come to this week, seeing more changes in the variant. So I'll just go ahead and turn this over to Julianne Van Loo in the Health Department and let her offer the presentation and our update as to where we are. Ms. Van Loo?
Thank you, Doug. Thank you, Mr. Mayor and Commissioners, for having us here again this evening and for your continued support throughout this entire pandemic. I have with me this evening our Health Officer, Dr. Alan Greiner, our Deputy Health Officer, Dr. Aaron Corvo, and our Chief Epidemiologist, Elizabeth Gronway. We'll go ahead and share my screen, get us going here. All right, this evening we will be providing a COVID-19 situational update so everybody understands where we are today, speaking about our vaccination efforts and the progress that we've made and providing some recommendations. To lead us off with our situational update is our Deputy Health Officer, Dr. Aaron Corvo.
Thank you, Julianne. Good evening, Commissioners, and to the public and the Mayor. Just want to talk a little bit about what's going on in our community right now as it relates to the number of COVID cases and what we're seeing in our percent positivity and such. So unfortunately, regarding the number of cases that we're seeing on a day-to-day basis, we've popped back up again. We're back where we were back in January. And so on average right now, we're over 50 cases. We've been hovering between 50 and 60 for the last several days. So very concerning. Next slide. Regarding our percent positivity, now to remind everyone, that is of all the cases that we perform in Wyandotte County, what percentage of those tests that we do are positive. We're seeing a very high percent positivity, so up over 30% at this point. So for the last several days, we've been just above 30% or just under 30%, but again, quite alarming. You can see that we're back where we were again in sort of mid-January on that front as well. Next slide. Could you advance, Julianne? Thank you. Regarding, oops, There we go. The COVID cases by age, we're seeing a real change here in the last couple weeks. You can see how young people are really getting the virus and unfortunately spreading the virus. We think that this pandemic is now really being driven by young people, and we've seen that trend over time. Folks are becoming younger and younger. You can see there that folks in their 20s, my goodness, really high numbers of cases in that 10 to 19-year-old category as well, and even younger. This is particularly concerning, I think, as we look towards a new school year. And so just also concerning because many of these young people cannot get vaccinated. We don't have vaccines approved for them. Next slide. I want to talk a little bit about this Delta variant. Clearly, this has been in the news a lot lately. We know that the Delta variant first showed up in the United States just in March, and now 83% of cases across the country are identified as the Delta variant. In our region here in the Missouri, Kansas, and Nebraska region, 96% of our cases are identified as Delta. And, you know, in Wyandotte County, since July 1st, 100% of sequenced positive cases have been the Delta variant. So it's really raging in our community. Unfortunately, this variant is far more transmissible than the other variants and than the wild type of the coronavirus that we initially saw. And so we think that it's far more aggressive, and that's why it's been able to move so quickly. You know, it's causing really a huge amount of community spread. And of course, we'll talk more about our vaccine rates in Wyandotte County, but we believe that it's really raging here because of our continued low vaccination rate. Next slide. I also want to give a quick update as to our hospital situation in and around the region. Unfortunately, our hospital resources are becoming strained. We have seen that since early June, we've had a tripling in the numbers of patients in our hospitals within the region, and that is certainly true within our Wyandotte County hospitals as well. Many of the people who are hospitalized and who unfortunately succumb to COVID have not been vaccinated. We still know that vaccine is the best protection against this new variant, against the Delta variant. You know, I have to say that at KU Medical Center, we're seeing more and more cases hospitalized. We have had approximately in the last few days 35 or so active cases of COVID, and in all around 60 or so cases hospitalized, with those also who are recovering. Our ICUs are becoming full. I believe we've got approximately 16 people in the KU ICU at this point in time. We are seeing some breakthrough cases, and that is meaning cases of COVID in individuals who are fully vaccinated, although it's extremely rare to see those people hospitalized. Our worry is that some of the people who have received the vaccine at this point are elderly, or they have immune issues so that they can't make antibodies, well, despite receiving the vaccine. And those people are at very high risk from this Delta variant. We have unfortunately seen one death from an individual who was fully vaccinated. And so that was an incredibly unfortunate case in our community. But I think it's an important lesson as well. We do know that our CMOs are worried at this point in time. We've had many conversations with them over the past couple of days, and they're in support of any mitigation measures at this point in time that we could put forward that would put a stop to this very quickly. I do believe that they support masking at this point as well. Next slide, please. I'm going to turn it back to you, Julianne, and we'll go from there.
Thanks, Doc. I'm going to provide a little update here on where we are in Wyandotte County on our vaccination efforts. A little bit of good news to lead us off here. Of those folks in our community who are eligible to receive the vaccine, and of course, those are individuals age 12 and older, we have reached the 50% threshold of those folks having at least one dose, which is encouraging. Our older population, which has steadily maintained kind of a stronger position than all of our other age demographics, continues to improve as well. Our 65 and older population now having at least 67% of folks with at least one dose. The other encouraging information is that we continue to improve in vaccines, especially compared to other Kansas counties. So 4 months ago, we were ranked 102nd in the state compared to all counties for our vaccination rates. As of yesterday, we ranked 28th. And that really is a testament to the incredible work of your health department, a testament to the resources you've provided us with, a testament to the ground game and the community engagement that we've put in place. So we're not where we want to be, but we continue to make improvements, and that's because we continue to put forward a robust vaccination effort out of our health department and our many partners. The less good news is that when you take into account our entire population, so age 0 to 100 plus, only 40% of our folks have at least one dose. So this really calls back into question what Dr. Corvo started speaking about, which is the fact that our 0 to 11-year-olds cannot get vaccinated because they are not eligible. Of course, we are incredibly worried because they return to the classroom here in a few short weeks. And without appropriate mitigation measures, those schools are going to become hotbeds for infection. Just a reminder here as we look at this data, that this data here includes individuals who are vaccinated anywhere in the state of Kansas, but does not include individuals vaccinated in other states or administered federally, like through the VA system. When we look at a breakdown for our vaccine rates by age, we see some real disparities here. As a reminder, in public health, we use rates so that we can compare groups to one another. If we didn't use rates, we would look at these age groups and not be able to compare them because they all have a different number of population in Wyandotte County. There's not the same number of folks who are in, the 18 to 24-year-old age group as there are to the 55 to 64-year-old age group. So we use rates so that we can see how we're doing across these different groups. And of course, this is the inverse to what you saw from Dr. Corvo earlier. Our highest rates of cases, which are among our youngest population, is also the population where we have the lowest rates of vaccine. And that makes sense because our less vaccinated populations are really contributing the most to that community spread. When we look at our vaccine rates by race, we are continuing to make improvements, but we do lag behind for our Black and African American population, our Native Hawaiian and Pacific Islander population. We're encouraged that those who identify with 2 or more races have high rates of vaccine, as well as our Asian population, but we continue to need to especially engage our Black population so as to make sure that we are doing this vaccination work equitably and not adding to the disparities that already exist in our communities. We're also very encouraged by our higher rates of Hispanic or Latinx vaccinations compared to our non-Hispanic population. Again, I think this is a testament to our partners, El Centro, Juntos, a number of Spanish-speaking churches who have really stepped up to the plate and worked with us. We are one of the only counties in the state of Kansas who have a higher rate of vaccine among our Latinx population than our non-Latinx population. And lastly, on demographics here, you can see our vaccine rates by zip code. It has evened out a bit compared to where we were a few months ago, but we continue to see disparities here as well, of course. Our Western zip codes are outpacing our other zip codes, some of them quite considerably. This is why you see more of our resources dedicated to our 66101, 102, 103, 104, 106 zip codes. We really have a pretty strong ground game going in these zip codes because they are further behind, and we need to, again, continue to mitigate the disparities. Again, just a nod to the health department's community engagement efforts. I won't spend a lot of time here, but we continue to vaccinate every single week on site at businesses, on site at schools, in people's homes, in congregate living facilities. We're very proud of the partnership we've put together with a number of churches in our Black and Spanish-speaking communities, which are really just have become ambassadors, not just with their own congregation, but with the community at large. We continue to launch new initiatives to engage parts of the population we haven't before, and we continue our on-the-ground canvassing efforts so that we have people doing that face-to-face really important education. And just as a reminder for the public, we are still here. We still want to come to your home, to your business, to your neighborhood group to provide vaccines on site. All of that is still available for free. And really all you need to do is give us a call or fill out a form, and we want to work with you. So the last part of our presentation tonight is around recommendations, but before I hand it off to our health officer, Dr. Greiner, I'm going to send it over to Misty Brown, our chief legal counsel, to remind us all where the statutory powers currently lie in regards to the ability to issue local health orders.
Thank you, Julianne. As she said, this is Misty Brown, Chief Counsel for the Unified Government. And this is a brief reminder of where we are statutorily. I know back in March, we had a discussion about Senate Bill 40, which was signed into law by the governor, and it made some changes in how we were doing things. Two of the big changes that we had is that school boards were given jurisdiction on their operations during the state of emergency. And further, it required the Board of Commissioners to approve a local health order if the health order would mandate mask wearing, limit the size of gatherings, curtail business operations, or control the population movement and limit religious gatherings. And in addition to this, it allowed individuals the opportunity to challenge the local health order in court. I am sure everyone has seen in the paper there's been a lot of talk about how a Johnson County judge has declared Senate Bill 40 to be unconstitutional, and the Attorney General has since appealed that ruling. So this matter is going to be in the court system, and we will see how it turns out. Thank you, Julianne.
Thank you, Misty. We'll go ahead and pass it to Dr. Alan Greiner, our health officer, for some recommendations for our community.
Great. Thank you, Misty. Thank you, Julianne. Thank you, Mayor and Commissioners. So we'll try to keep this pretty brief and just a few more slides here. I think, as everyone knows, our number one recommendation right now is get vaccinated. Julianne mentioned the ground game that's been going on. I think many of you are aware that we've really tried to move from mass vaccination sites to getting out there where the community is, and it is making a difference in terms of those state county rankings where we sit, and we've got to keep moving, because every percentage point we increase in vaccination really does make a difference. You can see that when you look at those different age categories, where we get slightly higher numbers in those age categories of vaccinated folks. We are doing better on the cases right now. Other mitigation measures, of course, we want to see people wearing masks. We've seen that works. We now have great evidence. Yes, we probably didn't emphasize that like we should at the beginning of the pandemic, but we know it works now. When you're outside the home, when you're around strangers, please mask. We need to social distance. We've talked about this 6 feet rule. We've made some slight changes on that for schools. As many of you are aware, our recommendations there are for 3 feet, but part of that's because we saw in school settings, kids really did a great job last year wearing masks. It made a huge difference. We were able to actually change the way we did quarantining in school settings, but 6 feet for those of us who aren't in school and aren't doing a good job minding our teachers all the time. We've got to keep emphasizing keeping people home when they're sick. The slightest symptoms, even if you think it's just a flare of your allergies, we need people to stay at home, stay away from other people, go get tested if you have any symptom that could be COVID. So scratchy throat, headache, fever, shortness of breath, even GI symptoms like diarrhea. Please keep that long list of 12, 13, 14 symptoms as something that you'll consider doing. We are seeing a huge uptick in testing, and that's great. We think that's, one, because people are very concerned about this uptick in cases, but two, because we've gotten that message out. And then other hygiene measures like washing hands, being careful around surfaces that you don't know if they're clean or not. Next slide. So we've put out some recommendations for schools. We put out a press release just yesterday. Dr. Corvo and our lead epidemiologist, Elizabeth Gronway, had a great meeting with some of the superintendents and school leaders earlier today. We are recommending universal masking for kids in K through 12, for teachers and for staff. As I mentioned, we're recommending physical distancing of at least 3 feet. We really want them to work on diagnostic testing and screening testing. We had a representative from Kansas Department of Health and Environment in the meeting today talking about their funding program, where they provide lots and lots of money if school districts will take it up so that they can test kids that have any of these symptoms quickly. They can test teachers, and they can do surveillance testing where they might do a larger group of students or others periodically. We want to work with them on vaccination, and we've been doing it. There was an amazing event at Harmon High School Tuesday night. Over 200 vaccinations administered there, really super. And there will be more. The school district has already reached out for another event. And then we'll be working with them on contact tracing. We hope that they're able to keep up with that. We've had trouble keeping up in recent weeks, but we brought on more people, and we'll get back on top of it, but we'll work with the schools on that. And we really want to encourage them to use those CDC guidelines on isolation and quarantine. So all this guidance for schools really comes from the CDC guidance, as well as input from experts at Children's Mercy and the American Academy of Pediatrics. Next slide. So what about long-term care facility requirements? Now, we have seen a lot of uptake of vaccine there among residents, so that's good. But we're still worried about them. And one of the reasons we're worried is our county is now a red zone. We've got that percent positivity has gone way up. The number of daily cases on average has gone way up. And we've got to keep testing, especially keep testing staff. That a lot of this comes down from the federal level, and there are requirements that the feds, especially the Centers for Medicare and Medicaid Services, CMS, requires in relation to their funding. They've got to test staff weekly. And if less than 70% of residents are vaccinating, they can't do indoor visits. That's only 3 out of 10 in our county. So 7 out of 10 of our facilities in Wyandotte have got over 70% of the residents vaccinated, which is great. And so they'll be able to have indoor visits, but they're going to have to do that staff testing. The last bullet you see there, the reason why staff testing is so important, we're not doing as well as we should on vaccination among staff. 8 out of 10 of the facilities have less than 70% of their staff vaccinated, and the majority have less than 50% of staff vaccinated. So we've seen a lot of resistance in that group. Now, it's a younger group, right? So it's the same theme. We continue to see this issue where in younger individuals, for a variety of reasons, they're not getting vaccinated, and we're trying to attack that in every way we can. Next slide. So what are our recommendations to the commissioners? From the Public Health Department, we're bringing these, for 2 primary reasons. One, we're following science, and one, we're trying to protect the vulnerable. That's what public health is about. We have a lot of vulnerable people in this county, as all of you know. So we're recommending that a mask wearing mandate or ordinance, just like we've seen adopted in Kansas City, Missouri, be deployed for indoor public spaces for both vaccinated and unvaccinated individuals, and for a 6-week time period. As you are all aware, I'm sure CDC came out with guidance for this as well, for areas that have substantial high transmission, which we have, and for both vaccinated and unvaccinated individuals. Next slide. And that's really it. Again, I think we're willing to take questions and hear comments, but we think this needs to happen now. As you saw, the number of cases is going up really fast. It's going to keep going up. If we don't do something before schools start, and you look at how Delta has affected other countries, we are going to have the same problem we had last winter. So I'll stop there. Happy to take questions, hear comments, and we've got Elizabeth as well. So.
Thank you, Dr. Grant. Thank you, Dr. Corvo, and thank you, Julianne. Commission, questions, comments? Commissioner Johnson.
Thank you, Mayor, and thank you to our medical staff, Dr. Griner, Dr. Corvo, and Julianne. Can you talk about, and maybe a little bit more specific, how we come about making the decision here locally? I know we have the recommendation from the CDC nationally that has come out, but can you kind of talk about the process as it relates to what you all, the dialogue that you all have with hospital staffs and things of that nature, that bring you to this conclusion and to this recommendation? Can you kind of give a little bit more specifics on that, and particularly for our listening audience, which I know is very, very interested in this?
I can jump in first, and the others may have comments too. I think, Commissioner, it's primarily the rising case rate, so the average number of cases per day, as well as the percent positivity increase. If you look at those changes, the case rate is now about 6 times what it was at our low period in April. And then if you look at hospital data, it's actually about the same. We have about 6 times the number of hospitalized patients right now as we had at that low point in April. And it's a really fast rise. And if you look at India and Britain, where this Delta hit before us, they had the same fast rise and they went way higher than we are right now. And so those rates put us in a high transmission category for the CDC. And the hospitals are concerned. One of the chief medical officers called me Tuesday night and had a previous meeting with all the chief medical officers from across the metro. And just to call and say, we need help now. We see worse things coming. We're already turning away transfers from southwestern Missouri, where the hospitals are full. And so we're reaching out to public health to see if you guys can get back on some of the things that you were doing last winter that we know made a difference. So that's where it's coming from, Commissioner. Other comments from our group?
I would just add in, this is Julianne, the director. I would add in that the reason why we're going for mask mandates specifically is because we need something very urgently. If 20,000 people came to us to get vaccinated tomorrow, that would be marvelous. And yet they wouldn't reach their full potential for their response to those vaccines for 4 weeks. That doesn't help the situation right now. What masks do is add this extra layer of protection immediately. If we started doing this tomorrow, it would drive down spread very quickly. And so it can do that actually quicker than the vaccine. And that's why the mitigation measure now is our call. Dr. Corvo or Elizabeth, anything to add?
Thank you. Oh, go ahead, Elizabeth.
I was just going to add, Julianne talked about how this is an important measure to take now to drive down case numbers. And it's important to take that action now because we're seeing 60 cases a day. So within the next week, if we're seeing 60 cases a day, we can expect in the next week to have 420 new cases. If, say, 5% of those cases need hospitalization, that's an additional 20 hospitalizations in 1 week that's going to be put on our already strained hospital systems, and an additional 6 deaths, unfortunately, in 1 week's period of time if we don't take action now to try to curb the spread as much as we can.
Okay, well, I know I have other hands behind me, so I will make one comment, and that is that even with I think you all are recommending 6 weeks, if I'm not mistaken. Does that are you all at all looking into the winter, and do you all expect for us to, regardless of what we're doing now, do you expect for us to have the same problems that we had last winter? And then I'll yield the floor, Mayor.
I think that's a great question, Commissioner, and we don't really know. We do have the interesting data from India and Britain with this Delta variant, and their case loads went up sky high, almost 75, 80% in Britain of what they had at their peak last winter. And they're already on the way back down. And their vaccination situation is kind of similar to ours. It's likely this will go way up high and we will see a lot of bad things, and then it will come back down before we get into any risk related to winter time. But we've got to keep working on vaccine because, as Julianne said, the masking kind of helps us immediately. The vaccination helps us a month, 6 weeks, 8 weeks out. If we can get that vaccination rate up by the time we get the cold weather and everybody comes indoors, that's really going to be key. But we don't know. There could be another variant on the horizon as well. I think we do know that Delta is going to be a big challenge for the short period, though, for all of us.
Thank you.
Commissioner Ramirez.
Thank you, Mr. Mayor. As always, Julianne, Dr. Greiner, Dr. Corvo, the Health Department, and all our frontline workers, these past 16 months, you guys have been the true definition of public servants. So I thank you very much for all that you have done. You continue to do. You work under very, very stressful timelines. And I thank you, as always, for everything that you do. I do have one question and some comments to make. On the vaccine data summary, it says that the data is not included from out of state or federally administered. Why is that?
We have worked our tail off, Commissioner, to try to get our hands on that data, specifically the Missouri data, which we know would be our highest out-of-state numbers. We have tried to work locally with health departments on that side. They're not able to give it to us directly. We have tried to work with their state health department. They're not able to get it cleaned up. We have pushed our state health department more times than I care to admit on this data, and we're really just hitting dead ends everywhere. So it is just, quite frankly, out of our hands. It's not accessible in our state database, and we're not able to get anyone on the Missouri side to provide it to us.
Okay, thank you. And it's kind of discouraging that, we can't, our partner next door, we're trying to work together and the state is not, I don't know if they're not willing or it's just their system is not compatible with ours. Is that what you're essentially saying?
I mean, this is the result of 2 decades of defunding public health. There is no appropriate technology infrastructure in the field of public health because we've been under-resourced for decades. And so our systems, quite frankly, weren't built for a pandemic.
Okay, thank you. It's known that the last time we had this discussion, I was for maintaining the mandate, and that's the same stance I take tonight. I'm going to speak open and frankly. Last night, I was at a small business social put on by the Rosedale Development Association, and I made it a point to go around and talk to some of my local small business owners about this, get their perspective. All of them support it. One made a very good point, and it stuck with me. I can't say what he said word for word, but in the essence of what he said is our inaction is hurting his business because the uncertainty of everything happening, he doesn't know if he's going to have to close or stay open. He can't get employees. And so that's why he supports the mask mandate, because that gives him some certainty that we're all working together for a final end. That point stuck with me because that's something I hadn't heard from a small business owner, was us not doing something hurting them more than us doing something. Us closing down, yes, hurt small businesses, but even the small thing of wearing a mask can help his business continue moving forward, where in the future he doesn't have to worry about another shutdown. We're at the point where I believe I and some other commissioners in the health department in the past 2 months ago said we would be at. We talked about, we didn't know what variants are going to show up, how effective, how transmittable those variants would be. And now we are faced with one that is worse than the virus itself. It's a variant. Now it's worse. And I've heard and I've seen that there's another one in Florida, a new one. And so this is going to be an ongoing thing. And so I think in my mind, we have 2 choices as a governing body. One is to do what's right and what's best for our community. I understand we're part of a metro and we're part of the Core 4, but let's not forget that when we started the Core 4, KCMO broke away because they wanted to do what's best for their city. And I think that's what we need to do for Wyandotte and for KCK. We're elected to be in charge, and not in charge, it's the wrong word. We're here to serve and protect this community. Not Johnson County, not KCMO, not Jackson County, Wyandotte County and KCK. The one choice I said was do what's right and let's reinstate the mandate for 6 weeks. It's a 6-week period. They're not saying, they're not giving an indefinite timeline. It's 6 weeks so that we can get this under control. Or the other choice is we allow politics, the politicization of this topic to dictate our policy choices as a governing body. The politics affects everything in our life, from our housing to the food we get to what grocery store comes into our neighborhood. When are we going to say, for me, enough is enough when allowing politics and the politicization of topics to rule what we do? Let's get back to what we're meant to be here for, and that's to create good public policy to bring our community, which was hit the hardest in this state. And we've seen through ARPA funding how many disparities we have in this county. This is only going to further that if we don't do what's right. So I ask this body that we really think about, come winter, come spring, come summer of next year, what is Wyandotte going to look like if we don't take steps now? And to end my statements of Julianne, Dr. Greiner, Dr. Corvo, the health department frontline workers, thank you for all you do. We can say it as many times as we want, but it needs to be heard. You have done everything based on the data, based on the science, and left the politics out of it. And so I thank you for that. Thank you, Mr. Mayor.
Commissioner Townsend?
Thank you, Mayor. Good evening to our health department staff. Just a couple of questions. Dr. Greiner, you mentioned when you talked about the long-term care facility requirements that Wyandotte is in a red zone. Is that only with relationship to our long-term care facilities? What gets us out of the red zone? Or are you talking generally about all of Wyandotte County, not just people who are in these long-term care facilities as residents or workers? That's the first question.
Yeah, so that criteria is actually set, I believe, by CMS. So Center for Medicare and Medicaid Services, which primarily funds nursing home care, sets but it's based on similar things to where we were talking before about being a county that's designated as high transmission rate by the CDC. It's similar things like the total daily rate of cases and the percent positivity of our total numbers of tests. So that red zone is a CMS thing. It only applies to nursing homes and the policies in nursing homes, but it's based on data for the whole county that shows a high rate of infections and a high rate of percent positivity.
Okay, it's based on stats for the county. It doesn't necessarily mean that the nursing homes themselves are
Correct.
over the top or with that.
Correct,
Okay.
correct.
Thank you. Okay. With regard to the recommendation to the commission, the recommendation basically has 3 prongs: indoor use of masks in public spaces for vaccinated and unvaccinated individuals and for a 6-week period. Are these the same 3 prongs, or maybe council can tell us, whoever can tell me? Are these the same 3 prongs used for the mandate that went into effect or will soon go into effect with Kansas City, Missouri?
I can speak to that to the extent that I know. We believe it's going to be along those lines. We have requested to see the actual language and have not actually been able to review it ourselves yet. So it is our understanding, though, that the intent on that side is that it is for vaccinated and unvaccinated, and it is indoor and public spaces. I cannot speak to the length of their intent.
Okay, thank you. Those are the questions I have for right now. I do agree with Commissioner Ramirez that wearing masks is a less restrictive alternative than, heaven forbid, our businesses or any aspect of our population have to go into a lockdown situation again. So I'll continue to consider this and want to hear from constituents. But I too supported back in April the continuation of the mask mandate we had then for another, month or so, basically because COVID has never gone anywhere. We've had our high and low periods, but the vaccination rates were still extremely low. So thank you.
Mr. Bach for, I think, Commissioner Burrows.
Thank you, Mayor. If I may, just for the Commissioner Burrows, if I may, just to ask a few questions to get some clarification. I believe it was stated about Judge Hauber's ruling on Senate Bill 40, and I'm just asking for some clarification. He did not issue the stay. Is that correct?
That's correct, Commissioner.
So by not issuing the stay, the Senate Bill 40 is not in effect.
I don't know that I would agree with that, Commissioner. I would say in Johnson County, it's not in effect, but this is persuasive authority, but it's not necessarily binding throughout the state. There are some questions to it. And if we get into further analysis, I would like to discuss that more offline to preserve our attorney-client privilege.
Sure. Thank you for that. I think it's important that we know and if I may, we have incentivized populations in this community. We have made facilities available. We have continued to offer contract tracing and testing, and we are still below in the metropolitan area, below the vaccination rate that we were trying for. And so I guess my question would be is that we can mandate, but if we're not going to enforce, then all we're doing is sending the message that you do not have to fall into compliance. If we're putting a mandate with no enforcement, it's nothing more than a strong suggestion. That's just how I'm reading it. The indoor public spaces that I would have a question on, is that government buildings or is that places such as Memorial Hall, churches, shopping centers? I'm just trying to get an understanding to what extent it means public places, just for those that may be listening this evening.
I don't know if council has any comments on that. I know that this came up, with our prior orders and things in the past. And we compared it to what we do with tuberculosis cases, for example, at the public health department, right? We've had for forever, right? We've had active tuberculosis cases that we follow and our nurses at the health department take care of. And those people cannot go somewhere and not be on medication to be treated for their tuberculosis, whether it's a church or a private business or whatever it is. If they're going to put other people at risk, we have the authority to get them on medication, or to put them in the hospital and get them treated. It's the same thing here from our understanding. Again, council may have other thoughts on it, but as long as people are going to be around other people and not able to maintain 6 feet of social distancing. And we put various clauses in the prior orders and had exemptions, right? When people can maintain 6 feet of social distance or in a business setting where people can be in an office, a private office, they don't need to wear masks. But it's basically the idea that if you're going to be around other people in a space, you're going to have to have a mask on.
So if I may, Dr. Greiner, and please, this is no attack on it and doesn't reflect on the information you've provided us. I have a tremendous amount of respect for the work that you all have committed to the public. My questions are just to clear up some of the questions that are being posed to individual commissioners and the community as a whole. So is a public place a small business?
Commissioner, this is Misty Brown. I would say, yes, a public space would be a small business where the public had access to.
So we will be mandating the wearing of a mask inside the small business that, in our community, small businesses in our community.
If that is the order the commission passed, yes.
And nowhere did I hear in the presentation, there was a compliance piece to this. And so that's my point. This is, to me, just nothing more than a strong recommendation, because without compliance, that's exactly what we're doing, is making a strong recommendation. And I'm not so sure that even with compliance, we would still get 100% compliance. But, and Dr. Greiner, so I'm trying to help here. I'm just trying to send the message that if people don't want a mandatory mask mandate, then at least comply with the strongly suggested or recommended mask wearing, so that we don't have to go into a complete lockdown and a mandatory mask with a compliance measure that could issue fines and or jail time, whatever position we end up having to take to get the higher compliance level that we need for the vaccination rate. But if we are incentivizing, even with dollars and gift cards, and we're still not getting compliance, I'm very concerned about the other rights of those that have taken the time to care about this community and wear their mask and get vaccinated and participate in the overall health of our community versus those that have chosen not to.
If I may, Commissioner, this is Julianne Vanley with the Health Department. The commission could determine that they wanted the Health Department to enforce this in partnership with the Police Department. That is an option that I would put out there. The second thing that I would say is that there are a lot of folks in this community who want to do the right thing, and putting this mask mandate into place, a lot of them would do so. In fact, a third-party evaluator last year looked at our mask wearing uptake among our community at large and found that we had higher uptake than the vast majority of communities in the country last summer. And so I just don't think we should dismiss that a lot of people will follow a mask order if we put it into place. Of course, not everyone. We're not under, that illusion. But just because we don't go out with police, to every business and enforcement doesn't mean that it's not going to be uptaken by a lot of our community members.
I do believe that is an accurate.
Commissioner Kane?
Thank you, Mayor. As always, I bounce things off the people in the district. I got a weird deal going now. 40% say no, 40% say yes, 20% say I don't care. But I'm also disappointed, and I know that that's not the health department's fault, but I know somewhere between 150 and 200 people from my district went to Missouri to get shots. So those numbers are actually higher than that what you're showing. And that's not counting some of my family members live out in Johnson County that went over there as well. I mean, this is a big deal. And I called the state doctor and he said, well, you guys, and he has no control over it. So I think those numbers are a lot larger than what you're showing. And you know that. Would be better if you said highly recommended than saying that it's being forced. And I have a little bit of frustration here because I have two churches that have already told staff that are willing to use their churches to get the shots. I've got one on standby. Two of them are in the urban core, and they came to me and said, would you do that? I contacted staff. Staff hadn't got back with me. It's because of Commissioner Mike Kane. Here's the deal. I want to help the community, but staff's got to say, okay, Kane, where are they at? And I've asked again today, and Julianne, I've called you a couple of times this week, and it says you're out of office or wherever you're at. Somebody should answer that phone and say, Kane, we're working on it. But I am not willing to completely shut things down. And before we take a vote, I want to know what Johnson County's doing, what Leavenworth County's doing, because I don't want to be in the same boat that we were in the last time where people had to leave Wyandotte County to get something. So I want an answer in the next couple of days about who's going to contact each church, where they're going to go, when they're going to do it. Because if you got two churches for sure and another one wanting to do it, you will get a large group. Don't just focus on one, and let's move it around so the community doesn't have that much trouble getting to the shots.
Thank you, Commissioner, and my sincerest apologies if there are partners out there who have not heard from us. We're really trying to funnel everyone through the same process. So there's a form online to fill out to signal your intent, and our team provides a return phone call within 2 business days. If there were surveys that were completed by partners that were missed by staff, I will absolutely address that as soon as I'm back in the office. So I will make sure to connect with you next week. It is not our intent to leave you or your district behind. Believe me, we want to partner with anyone who's willing. So my apologies if there has been oversight on our end.
Well,
Um,
and
I-
neither, and neither one of these churches are in my district. They just reached out to me to get help.
I don't care where they are. We'll come wherever.
don't
So
either.
it really does bother me that if there has been a call that we haven't responded to, I take that very seriously, please know. So I will make sure that we do so. Regarding Leavenworth and Johnson County, I can't speak to Leavenworth. I don't believe there's anything in the works. I did speak to the director of Johnson County Health Department this morning, and they had a commission meeting this morning where this topic was floated kind of just very briefly or not in depth, I should say, but they did commit to holding a commission meeting to address this specific topic of potential mask wearing. So I believe it's on an upcoming agenda for them, but there's nothing that's happening imminently in Johnson County this week.
Okay, thank you.
Commissioner Ramirez, we're running out of time. If you wouldn't mind, I would like to ask Commissioner Philbrook offer a few remarks first.
Well, as I understand it, basically, we're just asking everybody to put a mask back on. We're not going down into the extreme requirements that we had the last time. We're just saying, please, everybody, just put a mask on when you're around other people. And that's basically what it comes down to. Do I understand that right?
Correct, Commissioner.
That's just it. Just put a mask on. You're out in the public, just put a mask on. That's all we're asking. I don't think that's too hard to do. Even I can do that. And so, you know, I would ask for that. I'd ask that we respect other people's lives and please just put a mask on. That's all, you know. And if you can get a shot, please do get a shot to help protect a lot of other folks. And that's my stand on that.
Commissioner Ramirez.
Thank you, Mr. Mayor, and I'll just be very, very brief. I don't see where the difference between the order that we're trying to pass now and the order we passed last year, minus all of the other restrictions that we have put into the first order that we made. And I think Commissioner Philbrook put it perfectly. We're not shutting anything down. We're not restricting how many people you can have in your business. We're not restricting the hours of your business. We just ask that you put a mask on. And I don't see how that is, it's even better than the last order that we gave, honestly. All we're asking is just a mask. And so again, I ask that we, as a commission, think about the 2 choices. 1, do what's right for the best, what's right for our community, or 2, follow the politics of the issue. Thank you.
Any further comments or questions from the commission? All right, thank you. I want to thank you all.
Burrows has a quick question.
I'm sorry, thank you. Oh, Commissioner Townsend, thank you.
Thank you. Just so I'm clear, we're talking about a requirement. Is that correct? Health Department?
Our recommendation is that the commission adopts a mask mandate. So yes,
A
it would be
mandate.
a requirement, correct?
Okay. What I would like to see while we contemplate this, just from my, to refresh my recollection, what enforcement mechanisms were in place the last time there was a mandate? Because Commissioner Burrows does raise a good point. You know, if you're mandating something, there should be some follow-up. Not that we're trying to be heavy-handed, but certainly to, you know what that is. But certainly to impress upon the seriousness of this, if this were to go forward. So I'd like to see, to have my recollection refreshed, what we did the last time in terms of enforcement assistance? Thank you.
Sure. This is Julianne Van Loo again. So we do have statutory authority to penalize people with fines for not complying with the health order. We would follow the commission's directive as to whether or not we would want to do that. The last time around, last winter, for example, we never imposed a fine on anyone, but we did have COVID inspectors that we sent to hundreds of businesses and community places, and they had a 95% rate in terms of when they returned a second time, the order was complied with. So really, we just did a tremendous amount of education when we received complaints on businesses or other locations. We sent out educated staff. We provided them, if they needed it, with masks, with materials, etc. And we got really positive feedback and good compliance from those businesses. So the enforcement mechanism is there if we wanted to use it, but in my perspective, at least, the education and working with community partners is infinitely more effective.
Mr. Bach?
It's Commissioner Burrows.
Julianne, I just had a constituent text me to see what we've done in addressing our homeless population and wanted to know if our pets can transmit the COVID virus.
When you say in regards to our homeless population, in terms of working with them to mitigate the spread of COVID?
Yes, the vaccinations are available to our homelessness. Have we gone into the homeless community and houseless community to ensure that they've had opportunities to receive the vaccine?
Yes, we've worked with a number of agencies that serve that population. We've been out to provide vaccines on site with our mobile unit, I believe 3 times in 3 different locations, and then we returned for second doses. So we have made a good faith effort. There's always the opportunity for repeating some of those efforts. We've also worked closely with Care Beyond the Boulevard that routinely provides care to the homeless to make sure that they're doing the education, offering testing, those sorts of things. So absolutely. And the homeless population also has the ability to take advantage of our isolation and quarantine hotel program if they have an exposure or have tested positive, to make sure that we don't have outbreaks among that population. So there are a number of measures in place to serve that population. I'm going to throw the pet question though to Dr. Greiner or Dr. Corvo.
Corvo's probably the expert on this. I do know that there has been some studies looking at pets and that virus has been isolated on them, but I don't know of any documented cases where pets have actually transmitted to humans. So I think the risk, if it's even there, is extremely low.
I agree. I think that Dr. Greiner threw it to me because I have a dog, but a
very cute dog.
A very cute dog. There have been cases, I believe, of fomites on fur of animals, but that does not mean that has then been transmitted to humans. And so I think that that's a very, very low risk, and we're not seeing cases of that.
Thank you for that. Thank you.
Commissioner Bynum?
I just had a quick question about the legality portion when we speak about Senate Bill 40 and the authority that it has given to school boards of education. But what about the community college, Donnelly College, the higher learning institutions? What's their authority in determining their own policy?
Commissioner, I would have to refresh on that, but my understanding was that they would be also governing their own selves, being a portion of higher learning. So,
Okay,
but I will refresh on it and get back to you.
okay, thank you.
Okay, well, thank you. This has been for information and discussion. No action taken at this meeting. Thank you for your time and your concern. We're going to continue to study this. This meeting is adjourned, and we will begin again, I would say, at 7:10. Is that about the time it takes to transition over to the UGTV?
That's perfect, Mayor. Thank you.
All right, 7:10. Thank you all.